aligned. 'Cause it shouldn't hurt to smile. When your bite is aligned, you're feeling fine.
The top 3 symptoms that affected Kellie's life were migraines, neck pain, and fatigue, but she had many more symptoms than that, as shown here. She marked her pain pattern in this diagram, showing top of the head and behind the eye was the worst pain. But during the examination, 34 out of 44 places checked were painful for palpation. This one shows her presenting jaw. It doesn't look bad because it is nice and straight because she had braces before. However, her arches were not ideal. They were narrow, especially in the front. The ideal arch is shown in the yellow arch on the upper as well as the lower. This affects the amount of room for the tongue as well as how the joint aligns. This next image shows her temporomandibular joints were compressed both up and down and towards front to back. This one shows her jaw alignment. The bite alignment is tilted as well as her shoulders in the front, and from the side view her neck is forward because she's compensating for not having enough room for the tongue, and so that the airway is better for the neck forward. And measuring the airway with the CT showed it is a compromised narrow airway. This is when she's awake and sitting up, which should be worse in her sleep. This one shows the whole posture is affected by that. If the head and neck is forward, so would be the rest of the whole body. Here shows the resting EMG. It should be calmer than this when it is rest. It calmed down better after 60 minutes of TENS therapy. However, when the teeth were brought into occlusion just to bring them together, it took much too much effort. Ideally, it should be effortless. This next image shows what percentage of additional effort it takes for the temporalis just to bring the teeth together. The next image shows the ideal alignment of the upper and lower jaws, at least seen from the side. And the next image shows how those points were picked using the COM electromyography readings. So this one is how the teeth fit together in the myobite with the relaxed area of the muscle compared to when they're on the natural teeth. It shows, even before we start, if the jaw is put together, these muscles will be a lot less effort required, calmer. This is a diagnosed gap between where the jaw should be aligned compared to where they have been aligned. Using this information, we can now make a fixed orthotic that is bonded to the teeth, so the teeth come together here rather than how they used to, essentially making up the gap. It is done on a trial basis, so she wears it 24/7 and she cannot take it off. It is bonded for 90 days. Only when it improves enough, then something will be done long term. At this point, it is a reversible therapy. I can take it off. This one shows it is bonded on top of the teeth, so it does not crowd out the tongue space. Repeating the palpation showed the points went from 34 to 17 that were painful, then completely resolved. All points were not painful anymore.